Deafblind in Brazil. With Russ Palmer, music therapist, and Riitta Lahtinen, PhD, Social-Haptic Communication Researcher. In August 2015, Russ Palmer and his wife Riitta were enjoying a trip to San Paulo, Brazil. The day before they were due to travel back to the UK, Riitta noticed a problem with Russ's leg. Russ was subsequently admitted to hospital with a serious skin infection requiring urgent surgery and which could have proven fatal if he had flown. Russ and Riitta spent the next 2 weeks at the San Paulo hospital. Russ has chosen to share his experiences of being a deafblind patient in Brazil, along with simple ideas that could be adopted back in the UK. We now join Russ from his hospital bed. Russ, tell us about the coloured wristbands you are wearing.
One of the first things we recognise is, I think this one is.
Yep.
It says vulnerable or something. So that's something new I haven't seen before, which is a good idea because it alerts the staff, okay, you are vulnerable to this. Then over here I've got my name tag, Russ Palmer, date of birth, and then my allergy to penicillin. So one of the things that come to my mind is, first of all, why don't we use some sort of similar system in Europe that identifies if a deafblind person goes to hospital, they have a little tag which is bright colour, that's recognisable. It says to the nurses and doctors, this patient needs certain things and certain communication, or has certain communication needs. This saved a lot of explanation, and this being quite an unexpected surprise.
What would you recommend hospital staff be aware of when entering the room of a deafblind patient?
Well, first, obviously, say their names and then if they're a nurse, or if they're a doctor, or physiotherapy, so at least you get an idea. Because it's very insecure knowing somebody coming through the door, right, they have a uniform, but you don't know who they are, what they're going to do. So from that point of view, it's very important to have that identity first. But I do think that this simple little system is very effective and saves a lot of explanation.
Yeah.
And plus the fact it's unique to you as an individual, it's not, nobody else knows about it apart from the health professionals.
When nurses visit you at night to take blood pressure or to give medication, how do they communicate with you without your cochlear implants?
Well, what Riitta did was to show them the sign of the nurse, which is like a cross.
They have thesis of the nurse.
Yeah. And then blood pressure, etc. And we can talk about these later. Or if you're going to have a blood test, or if you're going to have an injection in the arm, and so on. So there are very simple little haptises we can use to save a lot of explanation, trying to put your implant on, what you're saying and so on. You can just relax and they just do this through touch. Because sometimes it can be early morning and the last thing you want is put your implant on or hearing aid on and trying to concentrate what they're going to say.
Yeah.
When getting out of bed, what aids are there for helping you?
Yeah, this is the what I call my Ferrari, where you can adjust the back up and down and also the middle part up and down and so on. But this is a very important landmark because when you're getting up you need, and because you're in a confined space, you need to feel, okay, that's my point. And many times we had to tell the nurses, please don't take that down because Russ needs to have it as a sort of support to stand up or just to feel, okay, this is my landmark, now I know where I am, I take my time and go from there.
Yeah. So you have been teaching that to the nurses that they have to always put it up, and like for your physiotherapist, when they take you to the walk, when you come back to the room, they need to guide you back to that
and
point
to show you that landmark
where you started your walk, not leaving you somewhere in a room.
That's right. It's an important process, and it's the feeling of security too. That, oh, I'm in the right place and so on.
How do you ensure food allergies are adhered to, especially when you can't see what's on your plate?
Thankfully, Riitta has been my sort of eyes on this matter, but they've been a bit slow to understand I'm allergy to this.
Yeah.
And I think we put a little message on the outside of a door even to say this, to no tomatoes and stuff, but still it hasn't been completely 100%. It's getting there, but we do need to double check. And this is very important because if you do have a food allergy, it's gonna set you back.
Yeah, because you had one day a food allergy.
I had a food allergy on my lip, for example.
Yeah, and sometimes somebody doesn't have any family members there, like now
No.
you have been with me or our friends,
That's right.
but some people don't have anybody, so it's very, very important that they check.
Absolutely. So it's a very lengthy process, and when you're dealing in another country which perhaps the system operates differently,
Yeah.
one department don't always communicate to another, as we found. You know, like the pharmacy department didn't seem to talk to the doctors, or they don't read their papers. And like when we have a physiotherapist, there are different physiotherapists every day. One physiotherapist didn't even recognise what blindness was until he saw my cane. It's important to have the same people, but obviously it depends on how the system operates. Perhaps it's not possible, I don't know. But no matter what they should have on the papers is to alert the person, this person has a deaf and blindness condition, they cannot hear and see so well, in a very simplistic, in a sort of bright colour on the paper or something. Not necessarily on the door, but having this here will indicate, right, I need to do this or find out more.
Yeah.
Have there been any cultural challenges in relation to your disability with being in a hospital so far from home?
Yes, there seems to be a very strange custom in Portugal of moving around very quickly, talking quickly and so on. It feels like ants coming in and going, and before that you can ask a question, they've disappeared. So that point of view, it makes you a bit stressed up when this is happening, and it's not particularly nice. Sometimes I just say, okay, let the world go by and so on, but other times have been when I said, hey, hang on a minute, slow down. Even the doctor, on one occasion, I had to say, could you please take your time, you know? So it may be a cultural thing, I don't know, but I have to say that the team has been very supportive all round. They have picked up things that Riitta described, what I have described, and there's everybody being very, very supportive and very flexible. That's the point. They've been flexible.
Yeah.
And they've also treated you with respect, and that's another point. You're not like a dog's body, or you're, the way the care has been marvellous. I have to say I've been quite pleasantly surprised, and thanks to Daniel, Dr. Daniel, he really saved my leg because it could have been quite serious, very serious. I could have even lost it, or I could have been died or something. So thanks for his smart thinking. I'm now on recovery and hopefully going back to the hotel this afternoon.
Mm-hmm.
What simple ideas have made your hospital stay a little easier, like the rolled up blue blanket on the bed?
Well, when I have my water bottle here, it's very nice to have something here so it doesn't fall down and I can feel, that's where my water bottle is. Or sometimes I have to swap it over to this side, depending on if I have the drip on this arm or this arm. I had a very painful experience of being stabbed many times trying to find my vein, which was not very pleasant. That was just unfortunate, but yeah, it's like a little landmark. Certain things you need at hand, you don't have to try and stretch and find. You just need to organise yourself in a certain way.
Yeah, just like your implant case.
And like my implant battery, it's very humid here, so I have to make sure that I keep it in my dry case to take away the humidity.
Yeah.
What ideas have come to mind from your experiences regarding medical issues and travel?
And I think this is very important because, no matter what, where you travel, you're going to get very big differences in services. But if you can do the preparations of, if you have certain medical things you need to put down, certain allergies, it's well worth the time spending just to write these things down, passport numbers, etc. Because it could be a situation where you could lose some of these things. You know, in San Paulo, for example, it's not exactly a very safe place to be, but we still have to be very, very careful on security. And we had an episode where I thought, well, I lost my mobile, somebody stole it. Sorry. So you have to, it's important information, and you have that there, and you can take it wherever you travel.
How have you kept your good humour whilst in hospital?
That's been very important. With me, when I felt I was sort of very low, I was always thinking positive. Really thanks to my mother. She used to say, don't let the buggers get you down. And that gives me a smile. No, I mean, with music, that when I started to walk, I started to sing to the nurses and even had a dance on one occasion. And it was just lovely. The humour is very important to look at the funny side of things, as Monty Python said. Look at the bright side of life. Yeah. There's one morning where I had my leg all done up in plastic, and so I couldn't get the leg wet. And Riitta was helping me in the shower, and we had to try and plan a time to make sure we could do the shower, give us plenty of time because it took a long time. And then as we were both there stark naked, the doctor knocked on the door and wondered what we were doing. So we call it hapteases in the shower.
Despite your stay in hospital, would you like to go back to San Paulo, Brazil?
Oh yes, I mean, you might think I'm mad, but the biggest thing for me is the warmth and the love and the friendships I've made. I have no hesitation in coming back. I know that, you know, I've just got to take care when I come back. But I have a mission now, which I can explain later. And I'm hoping that we can do a special concert to say thanks for their wonderful love and support they gave us.
Yeah. We have a very good friends here who has been helping us. Rula and Shirley. Yeah. Eduardo, the interpreter. Yeah.
And Rachel.
Yeah. Okay.
So, that's all for now. As you can see, I'm looking like a ballerina on this side. I'm hoping to be discharged soon, and this is Russ Palmer signing off from San Paulo, Brazil.
But this doesn't matter, 'cause I feel the blues, oh yeah. Singing the Deafblind blues. Baby, I can do this, oh Deafblind blues. My body feels the rhythm like a clock beating time. My heart